There has to be, I believe, some knowledge of the culture, the language in the country that you're working in, if it's not primarily English, because there are nuances there, and it's really important to understand what they expect and they want, so that there's not any overstepping, there's not any miscommunication about what can happen, what can be delivered. In our case, our leader, who is born in Guatemala and fluent in the language, she knows the people, she knows the dynamic there, and she understands how to navigate and negotiate through challenges. So I think that's extremely important, is having somebody in your group who really understands the people, the culture. You have to be adaptable and be prepared to maybe take on a different role than we would here. You can't, as a surgeon, go and sit in the lounge and wait for the room to turn over. You know, you have to be involved with washing the floors and getting patients and fetching supplies, and sometimes being the scrub tech rather than being the primary surgeon. So what have I learned through my experiences in global surgery? Well, one of the things I've learned is that to do this kind of work, there's no ideal or perfect time, in my opinion. There are always going to be competing interests from your personal life and family and children, and then your professional life with work and the administrative roles and everything else that we do. So waiting for that perfect time, you might wait too long. You have to accept that you will be sacrificing some things if you want to become involved. And I think that that's part of this whole experience, is that we are contributing in a way beyond just our skills. We're contributing our time away from the other responsibilities that we have in our life. And it can be very, very rewarding to do that. And so I'd encourage people to do it and consider that any time is a reasonable time to begin, and not wait for the perfect time. I also think that doing it mid-career is advisable, because you have experience, you've really tested your skills, but you also develop a certain judgment as to what can be done in some of these underdeveloped countries, what can be done, what should be done, and what shouldn't be done. The other thing I've learned about myself is that I'm a lifelong learner. I learn from the local physicians in a tremendous way, because they don't have the privilege that we have. I've learned about things that I never thought I would know about, and clean water, and how to build a latrine. I know how to build a latrine. So these kinds of things, it's broadened my entire life, and so I've learned that I can continue to be a learner, and I really enjoy that more than I expected I would.